Topic for the current video is why accelerated stability studies are done for 6 months for the pharmaceuticals. What are the reasons and why only 6-month accelerated stability study is done? Why it is not done for more than 6 months or less than 6 months? Welcome dear viewers to the video, and let's start with the basics. So stability studies are performed to ensure the pharmaceutical product is stable, safe and effective throughout the stability period or throughout the shelf life period. Stability studies are done to determine the shelf life period, expiry period, and also to demonstrate the product retains its quality over the period of time. Stability studies are to determine the shelf life period, the best suitable packaging system for the product. There are three different type of stability conditions: accelerated condition, real-time condition or long-term condition, and the intermediate condition. Accelerated condition is that condition in which the temperature and humidity are high. Accelerated condition is exaggerated conditions to quickly predict the stability. And long-term condition or real-time condition is the condition at which the storage conditions are normal, which are generally recommended for the product storage, and these are over an extended period. Now, what do we mean by the accelerated condition or accelerated stability studies? What is the reason for performing the accelerated stability? See, the accelerated conditions simulate the effect of time on a product under the stress conditions. That means the storage conditions are harsher than the normal storage conditions. The temperature is high and also the humidity is high for accelerated condition. And this accelerated condition predicts how a product will degrade over time. Generally, the period for accelerated condition is 6 months for stress or the stress condition. Now we'll see why 6-month study is performed. The 6-month study is a shorter period of time and it provides rapid data collection to speed up the product development and harsher conditions to simulate how the product behaves outside the optimal storage. One thing I want to add here is that the product will never be recommended to store at accelerated condition. Then why we need to collect the data or perform the stability study at accelerated condition? The reason is to evaluate the product at a condition which is outside the optimal storage, and it will simulate some harsher conditions or stress conditions, and it will provide rapid data for faster product development. That's why the accelerated conditions are performed for 6 months. Accelerated conditions or stress conditions are those conditions at which the temperature is elevated like 40 degrees Celsius, humidity is high like 75%. So fast tracking the degradation patterns to predict the long-term stability. That means from the 6 month of accelerated data, you can predict the long-term stability pattern. Then coming to the regulatory guidelines, ICH Q1A R2, ICH guidelines are standard for stability testing in the pharmaceutical industry. Accelerated testing condition given by ICH is 6 months to meet the regulatory requirements. Extrapolation for shelf life. Data from 6 months is used to estimate longer term shelf life. That means if you want to extrapolate 24 months at long term condition or real time condition, then minimum 6 month period is or 6 month data is required from the accelerated stability condition. Then what do the results mean? So shelf life estimation data from the accelerated condition helps to estimate the shelf life of the product. Example, stability for 6 months may imply a shelf life of 24 months under normal conditions. The simple meaning of this is if you have the product stable at accelerated condition for 6 months, then it can be predicted that it will be stable at normal conditions for minimum 24 months. Real-time testing results are used in conjunction with real-time data for final shelf life determination. So, by having the 6-month accelerated stability condition data, you can predict the 24 months normal condition data or the normal or real-time stability data. Benefits of accelerated stability studies. So it will provide you the predictive value. It helps to identify potential degradation issues early in the product life cycle. That means you don't have to wait for 24 months. You can have prediction from 6 months only. Cost and time efficiency. Faster results help to speed up approval process and reduce the costs. Regulatory compliance meets the regulatory requirements by authorities like FDA and ICH. So 6 months accelerated stability condition is recommended by the regulatory bodies. Then complementing real-time studies. So accelerated versus real-time data. Accelerated studies provide early insight into stability issues. Real-time studies confirm the product stability under normal storage conditions over a longer period. Comprehensive assessment. Both studies work together to ensure product safety and efficacy. Accelerated studies provide you the indication for any stability issues. In conclusion, accelerated stability studies are crucial for fast tracking stability testing and the product development. 6-month duration helps to simulate real world conditions, allowing for quick estimation of product shelf life. And these accelerated studies provide valuable data that supports regulatory approval and the timely market entry. That means accelerated stability studies can give you the indication about long-term stability studies and long-term data, or it will provide you the indication for any stability problems. So I hope this video will help you to understand why accelerated stability studies are done for 6 months. Thank you for watching the video, and let's meet you soon with such kind of informative videos.